The prevalent thought in our low-income communities in Miami is that if you contract HIV, you're going to die. People do not know that you can live out the rest of your life with HIV. I target people with the least amount of socioeconomic resources. Most of the people who I work with in the community don't have a high school education, don't have extensive English language proficiency, are scared of the public health care system. Many people are scared to take an HIV test because they don't know that they're eligible for Ryan White insurance if they're positive. And the thought behind that is, if I take a test, I'm not going to be able to afford treatment. So it's easier just not to take the test at all. So the people who I target are the people who have had the least amount of successful interactions with the healthcare system. They're the same people often who have failed out of formal education, which is why I use informal methodologies to try to reach them. They're people who don't trust a lot of the formal public health systems and just the formal systems or the government-oriented systems because they might be undocumented, so they're scared of being deported. They're scared of not having the money to pay for a test or for treatment. They're scared of the stigma that's going to be associated with the diagnosis of HIV. The people in the communities that I work with, oftentimes they're raped. They're the communities that suffer from the most types of violent sexual acts, and they don't know there's medication that you can take after that to prevent HIV transmission. And so I think that they're the most vulnerable populations in Miami-Dade who have been left with the least amount of resources. Community outreach is essential if we're going to make any progress in reducing HIV infections. Miami-Dade, for the longest time, has had the highest rates of new HIV infections despite all of the clinical advances. We now have medications that prevent HIV before you have sex. We have medications that prevent HIV after you have sex. We have medications that extend the life of people living with HIV, and yet the community suffering from the biggest problems with HIV often don't know anything about those discoveries. And so my job is to take that information to them with the resources so that they can keep themselves healthy. If someone is positive, you're going to get that assistance to get into care immediately and to get help taking care of yourself. That's taking the medications, and it's far beyond that. It's finding a job so that you can support yourself. It's finding a home so that if some of your medications need to be refrigerated, you have that support. It's about building a life. A lot of people say the day that they became HIV positive was the day their life turned positive. And my work has really, really helped me see that happen in real life. And it is one of the most rewarding things I've ever been able to be a part of. And all of our success, all of it, is due to community partners trusting us. And if we're able to do what I do, if we're able to replicate that throughout the United States, if institutions could send out community-based HIV experts to find these informal methodologies that really get to the populations that need them the most, HIV is going to be a thing of the past by the time my 3-year-old son is an adult. And I look forward to that day.